And Doctor, what's the status of the single-payer system in this country, and what is it going to take to get it passed by the Congress?
Well, right now, of course, we don't have a single-payer system. We have, in fact, gone the other way. We have this very perverse, for-profit, market-based type of healthcare system. And it's one that I think we've been trying to do for 50 years, and it's basically bankrupted this country. So I think what it's going to take, frankly, is that more people are going to start waking up and realizing that the healthcare system that they hear so much about and that's being publicized about is actually hurting us rather than helping us, and that we need to actually do what the rest of the world has figured out, that is to say, to provide a single-payer system for our country, where we can actually provide quality, affordable health care for all Americans.
I was shocked to find out that the percentage of people that are in bankruptcy are in bankruptcy because of medical bills.
Yeah, actually what's stunning is that more than half of the bankruptcies in America are not because you simply went gambling or overspent all your credit cards. It's because you got sick in this country and you cannot afford to pay your medical bills. This is a country that should be embarrassed that we would do that to our own citizens.
So what is it going to take to wake the people up that it's in their benefit to support a single-payer system? What is it going to take?
Well, I think people are really rightfully angry about the high cost of health care. What we don't know is how healthcare really works. Most people are very confused. They think, they just pull out a card and that somehow or another that's going to pay their bills. And until more and more of us speak out about the issue and start explaining why our healthcare bills are so expensive, why it actually covers so few services, and why most Americans who are faced with serious problems have to go through incredible hassles to try to get their bills paid. Until people better understand this, we're not going to really advance further. But fortunately for us, more of us are really angry about the way the healthcare system is working. We're going to see a lot more changes about this starting next year under the Affordable Care Act, and unfortunately, it will not be as affordable as people believe it's going to be, and we're going to have many more people who thought they were going to get a single payer are going to be disappointed they're not getting single payer, and will be demanding that we get single payer, particularly as we speak up about this whole issue.
Anything else, Tom?
Well, I would say that more and more Americans are really going to be in for roots awakening starting next year when they hear all this hype about what's going to happen with healthcare reform, and they'll be disappointed, I think, unless you're really, really poor. And for most Americans, they're going to start demanding that we have something like a single-payer system.
Okay, thank you very much.